Welcome to today's presentation on Medicare fraud, waste, and abuse, prevention and detection of fraud, waste, and abuse. This course should be taken by everybody who works in your office. So make sure that if they have not yet attended this webinar, that they click on the link provided and they attend the webinar to understand how to avoid participating in activities that might be considered fraud, waste, or abuse. The objectives of today's presentation are for you to understand what is fraud, what is abuse, understand the federal rules and regulations related to fraud and abuse, understand what programs exist to enable you to combat fraud and abuse, and for you to understand how to report suspected fraud. First, let's understand what fraud is. There are many things that are considered fraud when dealing with federal programs. If you knowingly do something wrong, that is fraud. So if you submit claims that are not correct, that they're false, or you make misrepresentations in order to receive payment, that is one form of fraud. If you offer to pay somebody to get referrals for items that are provided by the federal health system, such as Medicare and Medicaid, that is also fraud. If you make referrals in exchange for receiving payment, that is also fraud. So let's take a look at some examples of fraud. If you bill for appointments that patients do not keep, that is one form of fraud. If you upcode or bill for services at a higher level of complexity than you actually provided, that is also fraud. If you bill for services that you do not provide, that is fraud. And if you pay someone to send patients to you, so that way you can receive payments from federal programs, that is also an example of fraud. Bottom line is this: don't do it. It's illegal. If you do it and you are caught, there can be criminal and civil liability. You can be put in prison, you can be fined, you can be excluded from the Medicare and Medicaid programs. And those fines can be quite significant. You could even lose your professional license. Now, the next thing we have to worry about and we want to avoid is abuse. Abuse are things that result in unnecessary costs to the Medicare program. So if you provide patients with services that are not medically necessary on a regular basis, and then you bill for those services, that's abuse. Now, you're providing the service and you're billing for what you provided, therefore it's not fraud, but it still is wrong and it still is illegal. Abuse is definitely a thing that you should not be doing. So examples of abuse, as you've already seen, billing for unnecessary medical services, or having excessive charges for the services that you provide. If you miscode purposely, or you upcode, that is abuse. It also happens to be fraud. So sometimes when you're committing abuse, it could be considered fraud also. Now, in order to combat fraud and abuse, there are programs known as program integrity. And those are the services that the government has to target and prosecute and prevent various types of fraud and abuse. Program integrity is aimed at reducing practices that will result in excessive costs to the healthcare system. The programs are meant to reduce mistakes, such as incorrect coding. And yes, these can be mistakes. If they're not done on purpose and they're not systematic, it's a mistake. But the program integrity wants you to make sure that you don't make mistakes. Program integrity also helps to avoid inefficiencies, such as ordering excessive diagnostic tests. For example, if a patient walks into your office and you need an x-ray or a blood test, and they just had that x-ray or blood test someplace else, such as an emergency room or hospital, then it is more efficient to get the results of those tests than to repeat those tests yourself. And program integrity is part of the education to avoid these inefficiencies. Bending the rules is something that you do not want to do. Bending the rules could be considered to be abuse or even fraud. And intentional deceptions where you are actually lying and you are doing something that you know is wrong is definitely a result of fraud. And program integrity is there to prevent any of these things from happening. If you engage in incorrect coding, ordering excessive diagnostic tests, upcoding, or billing for services that you do not provide, these are examples of things that are fraudulent, that are abusive, and that are wasteful. And you could be subject to administrative, civil, or criminal liabilities. So do not do it. It's not worth it. There are various laws that make it illegal to participate in fraudulent activities, that make it illegal to participate in abusive activities, and make it illegal to participate in wasteful activities in a systematic manner. These laws are known as the False Claims Act, the Anti-Kickback Statute, the Physician Self-Referral Law, also known as the Stark Law, the Social Security Act, and the United States Criminal Code. These laws that we just went over specify what fines have to be imposed should you be caught doing any of these things, and should you be caught doing fraud or abuse in Medicare, Medicaid, and the Medicare, the parts A, B, C, or D. And once again, violation will result in non-payment of claims, monetary penalties, and exclusion from federal health care programs, in addition to possible civil and criminal liability. So let's look at these various laws in detail so you understand what each law is, what it says. The False Claims Act protects the federal government from being overcharged. So if you overcharge the government and they find out and you're doing this in a systematic manner, you can be hit with a False Claims Act suit. Now, in order for something to be illegal, you really need to know that you were doing it wrong. And actually, even if you don't know, it can be illegal at certain points. But for fraud, it must be something that you did deliberately. The False Claims Act does not require fraud. As you can see in the bold sentence on the bottom, no proof of intent to defraud is required to violate the False Claims Act. So let's take a look at the False Claims Act again. Overcharging is not necessarily fraud. If you willingly submit false or fraudulent claims, that's also part of the False Claims Act. But overcharging is not necessarily fraud, but is a violation of the False Claims Act. So let's take a look at some examples of the False Claims Act violations. First one, if you knowingly submit claims to Medicare at a higher level of service than actually provided, that is a violation of the False Claims Act. You are sending in a false claim, billing for services not provided. If you are hit with a False Claims Act suit, your penalties can be up to 3 times the amount of damage as a result of the false claims. So if the claim was for $1,000, it can go up to $3,000, plus up to $21,916 in 2017 per false claim filed. And when I say in 2017 that's because as inflation goes up, that number will go up, and the government has a table they publish each year as to what this number will be. In addition, a violation of the False Claims Act may result in imprisonment, and it may result in your exclusion from federal programs. The next law you need to be aware of is the Anti-Kickback Statute. Once again, key word here, knowingly and willfully. So the Anti-Kickback Statute is if you knowingly or willfully offer to pay or solicit to receive payment in order to either for you or for somebody else to bill the federal government for services, then either you are providing a kickback or you are receiving a kickback. And in either case, you are in violation of the Anti-Kickback Statute. Let's look at an example of the Anti-Kickback Statute. And this is one we have to be careful of, because this may be something that we have an opportunity to participate in. If you are to receive cash or to receive a rent for your office that is below fair market value in exchange for sending patients to your landlord, that is a kickback, and that is illegal. Now, what are the penalties if you are found guilty of violating the anti-kickback statute? Once again, 3 times the amount of the kickback plus up to $74,792, once again, and $217 per kickback. So each kickback can cost you almost $75,000 in 2017 dollars. Once again, remember, inflation will be calculated depending on the year. You could also be imprisoned. You could be excluded from federal programs. There are some safe harbor regulations that do not violate the anti-kickback statute. For example, if you have received an EHR from the hospital that you work with at a discount, that's actually a safe harbor. What are the safe harbors? Well, the best thing to do is, if you have a question, reach out to your healthcare attorney, look at the program, look at what you're being offered, and determine if this is one of the safe harbors. There is a whole list of safe harbors that have been listed by the federal government. So always double check. The next law that we need to be aware of is the physician self-referral law, or the Stark law. It prohibits you from referring patients that are going to be paid by Medicare or Medicaid to a facility that you own. For example, if you own an MRI facility and then you refer patients to that MRI facility, you could be in violation of the Stark law. There are some exceptions, and once again, if you have these facilities and you want to refer patients, speak to your healthcare attorney. Find out if any of the exceptions apply to you and what you can and what you cannot do. An example of the Stark law is if you were to refer a beneficiary to services in which you have an investment interest. For the Stark law, the penalty is up to $24,253 for each time that you self-refer. Plus, any claims that you receive payment for, you will have to return. At least in this case, it's not 3 times the amount on the claims, but the $24,253 per occurrence, I'm sure, is much more than any claim payment. And once again, violation of the Stark law can result in you being excluded from federal healthcare programs. So let's take a look at the differences between the anti-kickback statute and the Stark law. And this table here, which we'll go over a few pages, we'll go over it. What is prohibited in the anti-kickback statute? You cannot offer, pay, solicit, or receive anything of value to induce referrals or generate referrals for federal healthcare programs. So the anti-kickback statute is specific to federal programs. The Stark law prohibits you from referring patients to a facility that you own and receiving payment for that. So what about referrals? The anti-kickback statute, that's referrals from anyone. You cannot pay anyone for referrals, and you cannot receive payment from anyone for making referrals. For the Stark law, it's only from a physician. So for example, you cannot pay a drugstore to send patients your way on the anti-kickback statute. That does not apply in the Stark law because that's not a physician. As far as intent, for the anti-kickback statute, intent is vital. They must be able to prove intent. For the Stark law, there is not necessarily an intent to receive the money, but you do have to have intent if they want to hit you with civil penalties. Now, what are the penalties? For the anti-kickback statute, up to $25,000 per violation, up to 5 years in prison. You could also be hit with the False Claims Act with up to $50,000 per violation and 3 times the amount of kickback. For the Stark law, you have to return the money, and you could be paying up to $15,000 for each service. And once again, treble penalties. There are safe harbors for the anti-kickback statute, and there are mandatory exceptions for the Stark Law. The anti-kickback statute is all programs, all healthcare programs, and the Stark Law specifically is Medicare and Medicaid. The next law that we want to talk about is the Criminal Health Care Fraud Statute. Once again, the key words here, knowingly and willfully. So if you knowingly or willfully execute or attempt to execute some sort of scheme to defraud the government or any health care system. So it does, and the Criminal Health Care Fraud Statute goes beyond government programs and goes to private insurers. If you do this for any health care program, you are in violation of the Criminal Health Care Fraud Statute. So an example of a violation is if a number of doctors get together and conspire to defraud a healthcare program by submitting medically unnecessary claims for power wheelchairs. Penalties for violating the Criminal Health Care Statute may include fines, imprisonment, or both. There are exclusions, and under the exclusion, the OIG stands for Office of Inspector General, has to exclude providers of any of the following. Now, these exclusions mean that you cannot participate in Medicare, you cannot participate in Medicaid. So if you are hit with a penalty and found to be in violation of the laws, if you commit Medicare fraud, you cannot participate in Medicare and Medicaid. If they find that you abuse or neglect your patients, you have to be excluded from Medicare and Medicaid. If you are convicted of a felony for a health care related fraud, theft, or financial misconduct, you must be excluded from Medicare and Medicaid. And if you are convicted of a felony for unlawful manufacture, distribution, prescription, or dispensing of controlled substances, you must be excluded from Medicare and Medicaid. These are required. There is no wiggle room on this. Violation of any of these laws results in your exclusion. There's also something known as permissive exclusions. The OIG and the government is permitted to exclude you from Medicare for other things. So if you are convicted of a misdemeanor related to healthcare fraud, you can be excluded from Medicare. This is at their discretion, so you may or may not be. If your license is suspended, revoked, or you have to surrender it for reasons bearing on professional competence, professional performance, or financial integrity, they could exclude you from Medicare and Medicaid. If you are found to have provided unnecessary or substandard services, you can be excluded. If you submit false or fraudulent claims to a federal healthcare program, you may be excluded. If you engage in unlawful kickback arrangements, you may be excluded. And if you default on a health education loan or scholarship obligation, you may be excluded. So what will happen is if you do these things, they can look at you and decide to exclude you from the federal programs. So what is the impact? Well, if you are excluded, you're going to be excluded for a designated period. And if you are excluded, you cannot bill Medicare, Medicaid, or any other healthcare program for services. An employer cannot hire you to work and then bill one of these programs for your services. So therefore, if you are excluded, you can't work for someone else and have them do the billing while you provide the services. This is one of the reasons on every federal claim form, you are supposed to indicate A, the billing provider's NPI, and B, the rendering provider's NPI, and the federal government looks at both to make sure both the billing and the rendering provider have not been excluded from the Medicare or Medicaid program. If you have been excluded when the exclusion period ends, you have to apply for reinstatement. It is not automatic. Next law that we need to talk about is the Civil Monetary Penalties Law. The Civil Monetary Penalties Law allows the government to go after you for up to 3 times the amount of money that you received improperly or illegally. So violations that can justify the civil monetary payment law coming into effect is presenting a claim that you know is wrong. That's upcoding. That's for services that were never rendered. If you do this, you have violated the anti-kickback statute, and the civil monetary penalties can kick in. And as I said before, there's an inflationary adjustment. We went over some numbers based on 2017, which are the latest published that I could find. But each year they get adjusted. And if you can want to look at the adjustments, you can look at the Federal Register, CFR 45, section 102.3, to see what those yearly adjustments are. The government is very dedicated to fighting fraud and abuse, and they have developed a number of fraud and abuse partnerships to monitor what we do, look at our claims, and see that we are doing things properly. The first partnership is a healthcare fraud prevention partnership. It's a voluntary public-private partnership. It involves the federal government, state governments, law enforcement, private insurance plans, and anti-fraud associations. And these people all work together, and they share information to try and detect fraud. So who is in this? Well, a number of federal organizations are, and that makes absolute sense since the majority of the money that's paid out for healthcare is federal money. So it includes Department of Defense, Department of Health and Human Services, Department of Justice, Department of Labor, Department of Veterans Affairs, and even the Postal Service. Various state governments and organizations are also involved. We can see Alabama, Arkansas, Arizona, California, Connecticut, District of Columbia, Florida, Illinois, and if you go down the list, you will see that many, many states have their healthcare programs and their law enforcement programs part of this partnership. Now, here's where you also have to pay attention, because in addition, private insurers are monitoring, and they are looking at what's going on because they also want to prevent fraud, waste, and abuse, because this increased their costs also. So if a private insurance company happens to be auditing and finds that you've participated in fraud, waste, and abuse, and they're on this list as members of the program, it's fairly safe to assume that they may report their findings to the federal government for additional legal action. A number of associations that work to combat fraud are also involved, and you can see that the American Health Insurance Plans are, which covers many other health insurance carriers that are not directly involved. Various associations, Coalition Against Fraud, National Association of Medicare Fraud Control Units. Lots of people are watching what we're doing, and they're monitoring what we're doing. In addition, the federal government has hired contractors, private companies, to look at our claims, look at our billing patterns, and try and identify and detect fraud or potential fraud, and as a result, come in and audit us. You may have heard of some of these programs: the Comprehensive Error Rate Testing Program, or CERT, the Medicare Administrative Contractors, or MACs, the Medicare Drug Integrity Contractors. We've all heard of RAC Auditors and Recovery Audit Program, Zone Integrity Program, Unified Program Integrity Contractors. These are all private companies that have been hired and are paid by the federal government to help prevent fraud. And in many cases, some of these contractors, when they identify fraud and are able to get money back from the government, share in the money that comes back. So they've got a definite incentive to identify and prosecute cases of fraud. All of this is overseen by the OIG, or the Office of Inspector General. They oversee all federal programs, including Medicare and Medicaid, and they work to make sure that money that is spent wisely. Because even though we as providers receive that money, we as taxpayers pay out that money, as does every other tax-paying American. And the job of the OID is to have a fiduciary responsibility to all taxpayers to make sure that the money we spend does not go to fraud, waste, or abuse. There's also another, shall we say, organization called the Healthcare Prevention Enforcement Action Team, or HEAT. And this is a partnership of the Department of Justice, the Office of the Inspector General, and the Department of Health and Human Services. And they are working together to form a strike force that targets and mitigates fraud schemes and stops them before they can start. Now, if you report fraud, waste, and abuse to certain programs, it's a possibility that you will get a reward or a finder's fee. There was a recent case where a large EHR vendor faked their certification, and as a result were given certification for meaningful use, and it was found that they faked the certification. That that EHR provider was fined $155 million, and the whistleblower who reported that fraud got a very, very nice check. So if you want to report fraud, waste, or abuse, you can call the OIG hotline at 800-447-8477. You can send a fax to 800-223-8164. You can go online to forms.oig.hhs.gov/hotline-operations/index.aspx, or you can send mail to the Office of Inspector General, attention OIG hotline, P.O. Box 23489, Washington, D.C. 20026. There are lots of resources available to you to help you understand what fraud is and help you combat and avoid participating in fraud, waste, and abuse in your practice. And these resources, you can see the resource and the website are on these slides. Now, you can always watch this webinar again and make screenshots of these slides so that way you can see what this is. This webinar is always available to you. So the resources we'll go through for the OIG, questions about the Stark Law, the False Claims Act, Civil Monetary Penalties Law, Code of Federal Regulations, comparisons of the Anti-Kickback Statute and the Stark Law, the Criminal Healthcare Fraud Statute, the Exclusion Statute. You can even see a list of the entities that have been excluded from Medicare and Medicaid because of fraudulent activity. If you're ever not sure if what you're doing is right, or you're presented with a contract or an opportunity that you're unclear as to does this opportunity violate any of the laws, it really is in your best interest to reach out to a healthcare attorney and have them look at that arrangement, look at that agreement, and make sure that it does not violate any of the laws. Because whatever money you spend to make sure that you're doing it right is well worth it to prevent you from being fined for violation of any of these laws. And the final set of resources, you can go to the OIG, you can go learn about the physician self-referral law, and the safe harbor regulations, because there are many times when you can do things that might on the surface look like it's a potential violation of the law, but there's a specific carve out or a safe harbor. And once again, this is where your healthcare attorney can be vital in helping you to understand what is right and what is wrong. Thank you for attending. Please take advantage of this webinar, review it, utilize the resources, reach out to your healthcare attorney, and make sure that you and your practice don't either on purpose or inadvertently violate any of the laws that we discussed in tonight's presentation. Thank you.